Welcome to Wholesome Wednesday, session number 83. And it is all about Saris and cervical screening health talk by the Pink Sari Incorporated group. You know, it's such a beautiful group in Sydney, and they are there to provide the support the women need with in taking care of health. As you all know, health is better than wealth, and we have all figured out during this COVID times, especially the last 2 years. And we have known, what health is. Even wealth in front of it is nothing. So if you take health, the first 4 words is HEAL alphabets, and it is nothing but heal. So what best opportunity for us to talk about health in a healing way. So health is a state of complete harmony of the body, mind, and spirit. When one is free from physical disabilities and mental distractions, the gates of the soul open. And this is a quote by Sri B.K.S. Iyengar, and he is the yoga guru, and he has mentioned it so rightly. Just a brief introduction of the Pink Sari Incorporated group. It is a not-for-profit organization established in 2016 and is run by a dedicated team of volunteers. And I have got 4 people with me, four gorgeous ladies, and I'll be introducing you all one by one to all the volunteers. And it is such a brilliant team doing a very, very brilliant work. And I have attended a couple of their talks and sessions, and it is very informative and very encouraging, and it is a great support, especially for the migrant population. And the vision of this Pink Sari Incorporated group is to provide primary and secondary carers of cancer patients, people diagnosed with cancer, those in remission, and survivors with information, knowledge, understanding, and skills to better support the people they are caring for, as well as to take better care of themselves. It is such a great initiative. And January, the beginning of the year, this month is dedicated to cervical cancer awareness program. And I took the opportunity to jump in to team with this beautiful Pink Sari Incorporated group to raise awareness to the Sari Gallery group. And obviously it's all about women and women well-being and healthcare, to give the importance of cervical screening. And it's often a stigma very much blamed for. To clear all the doubts we have, a group of 14 of 4 gorgeous ladies to discuss about the awareness of this cervical screening, as well as to shed some light what can be done and how best this could be taken care of and how we could be benefited with. So I have Dr. Rekha Rao, who is the subject matter expert, and Mrs. Shanta Vishwanathan, who is the president of the Pink Sari Incorporated group, and Dr. Rukmini Venkataraman. She is the sociologist, as well as she has worked in various NGO sectors in the state government, as well as in the community sector. And she is here to give us the information on various aspects of cervical screening with a presentation, so that our our knowledge is enhanced. And I have Kashmira there, who is very reluctant to come on the camera. And there's something to tell you ladies about Kashmira, which I will be shedding some light. Probably she would say no, but I am daring to do that. There is something to learn with Kashmira, right? And she is the public relations officer for the Pink Sari Incorporated group. And she is also the technical guru for our Zoom meeting and to go live with Facebook Live, right? So, and Dr. Rekha Rao, I'm sure you all have met her in my Sari gallery for the breast talk as well, which happened last year. And she is going to shed what we have to do and what we should take care of in a Q&A session, which we would be hosting in a couple of minutes. So here you go. I will hand over to Shanta to say briefly something, if you want to say about the pink sari, and then Rukmini would kind of like, do a presentation, and then we will be having the Q&A session.
Thank you so much, Hema, and to also the Sari Gallery, which you're a founder of, for giving us this opportunity to present our session, because we can only do what we do if the community supports us. And this has been a tremendous support, especially during this COVID times. Normally we run our sessions face-to-face.
Yeah.
So running a session online and giving us this platform, not just to get our message across to people in Sydney, in Australia, but worldwide. I think that's really commendable. Yeah. So thank you so much.
I'm so happy. I'm sure at least out of 8,000, at least 2,000 would be watching this.
That's perfect. I think it's a message that needs to go to all women. And as you will soon hear from Rukmini, women between 25 and 74, it's so important to have to be screened, because early detection is the key. Early detection saves lives. So that is the message we want to communicate to our community. So I don't want to take much time, but today, I think we women generally tend to put our health behind. So we need to make health a priority for ourselves, so that we can also take care of those around us as well. So I think there are lots of myths about cervical screening, which hopefully will be answered at the Q&A at the end of the session. So I'd like to welcome all your viewers, and also thanks once again, Hema. Lovely to see you in teal. Lovely to see you in teal. We are all in pink, but
exactly
the color for cervical cancer.
To mention, or the pink ladies, or the pink sari group, can call them pink ladies today. They are in their beautiful tussar silk saris. I'll be posting that tonight. I'll ask them to post a picture of theirs, and then I can collage it and send it across. And they are wearing a beautiful pink sari there. And I'm wearing a kota cotton sari from Rajasthan.
Lovely. You look gorgeous. Thank
you. Yeah. So Rukmini is going to do her presentation, is it?
Oh, thank you, Hema. And good evening, ladies. I'm glad to be here during this month of Cervical Cancer Awareness Month to share some information about what is cervical cancer and the importance of regular screening of cervical cancer for maintaining the health of our cervix, and also to help the detection of this cancer at very early stages, so that we can save lives and improve quality of life. Now I will share the screen with you to show you some slides. I'm first going to talk about, in general, about what is cancer, and then we will move on to look at the female reproductive system, and then talk about cervical cancer as such. Our body is made up of millions of cells, and these cells are constantly multiplying and replacing the worn out cells. So this is a normal process which happens every minute of the day. Now, occasionally it happens that some of the cells, they multiply abnormally or become abnormal and unhealthy. And we would not have a clue that this is happening in our bodies. But it so happens that our bodies have the capacity to repair these abnormal cells and correct them. So that happens as a natural process. But sometimes these abnormal cells multiply, and when they are not being repaired, they can eventually turn into cancer. As you can see in the picture, in the slide, these are the normal cells, and then you have some of the cells becoming abnormal. They can get repaired by the body by itself, and sometimes when they multiply abnormally and are not being corrected by the body, then they can become cancerous. So cancer is actually a disease of the body cells. So there are tests that can be done to detect cancer at an early stage for some types of cancer. For example, we have mammogram for breast cancer. And today, as I mentioned earlier, we are talking about cervical cancer and the cervical screening test, which checks the health of the cervix. Now, I might sound like a biology teacher, but we do need to have a look at the female reproductive system to understand where the cervix is located and where the cancer happens. Now, as you can see, this triangular part is the uterus, which actually bears the baby. And then you have two tubes, one on either side, the fallopian tubes, and then the fallopian, each tube ends in the ovaries. So the eggs are produced in the ovaries, and the egg travels down the pipe, this tube, and plants itself on the wall of the uterus. So this is where the baby is formed, or the fetus is formed. Now, just going down a bit at the mouth of the uterus, that portion is what we call a cervix. And then following the cervix is the passage which leads to the outside. So this passage is the vagina, just made of stretchy muscles, and it opens to the outside through the vulva. So we are talking about the cervix, which is located at the mouth of the the uterus, and it is a short passage leading into the vagina. And the cervix, when the baby is formed and grows in the uterus, the cervix tightens to hold it in place. So this is the role of the cervix, when we talk about cervical cancer, this is where it happens. Now, what causes cervical cancer? So almost all cancers of the cervix are caused by a virus called the human papilloma virus. Sometimes we call it as HPV. So there are more than 100 types of HPV, but not all these types of HPV cause cervical cancer. So, and HPV can be passed from one person to another through skin-to-skin contact, particularly of the genitals during the sexual activity. So HPV is found both in men and women, and anyone who has been sexually active could have the human papilloma virus. Now, HPV, as I mentioned earlier, is passed from one person to another through skin-to-skin contact of the genitals. So this can be passed between husband and wife, so long-term partners or short-term partners, or even amongst those who have had one-off relationships, as well as women in the same-sex relationship. Now, sexual activity includes the sexual intercourse, oral sex, anal sex, any type of genital skin-to-skin contact, and including the use of sex toys. So the body has the capacity most often to clear up this human papilloma virus by itself. And within a year or two, so there'll be no problems. So it can be cleared. And sometimes the body does not clear the HPV by itself. And this human papilloma virus can sometimes lead to cervical cancer. Now, how can cervical cancer be prevented? We do have, as I mentioned, the cervical cancer, the cervical screening tests are very important. But before that, we need to look at the cervical cancer, which can be prevented by receiving the HPV vaccination. And this has to start once the boys and girls become sexually active, or even before. It's advised that the vaccination is given before they start the sexual activity. So in Australia, all the boys and girls get a free HPV vaccine at high school. And the HPV vaccine protects against, as I mentioned earlier, there are more than 100 types of HPV types. And the vaccine actually protects against 7 HPV types, which cause around 90% of these cervical cancers in women. So by vaccinating both the boys and girls, by vaccinating the boys actually, can prevent them from getting the HPV and passing it on to a partner. So if a woman has received the HPV vaccine, usually at high school, she would still have to have regular cervical screening tests once she turns 24. This is because the vaccine does not protect against all types of HPV. We move to the next slide. So yes, so cervical cancer can be prevented. So the first part is the vaccination, and then the second part is the screening. Most of you would have heard about pap smear tests. So this pap smear test was also a screening test, and we had that until 2017. And those tests had to be done every 2 years. But this cervical cancer screening test can be done every 5 years. And they are more accurate than the pap smear test because the cervical screening test looks for HPV in the cervix and any cell changes that could eventually lead to cancer. So it is not actually a test for cancer, but actually looks for HPV in the cervix and any cell changes that could possibly lead to cancer. So we have to remember that. And those who have had pap tests previously, the cervical screening test feels similar to the pap test. Now, the process of the test or what happens during the screening. Let's go to the next slide. Okay. Sorry. Now, before that, so who should have the cervical screening test? As I mentioned before, those who have been sexually active, and women between the ages of 25 and 74. And it is recommended every 5 years. And women who are pregnant, it's safe for them to have the cervical screening test at any time if they are overdue. And once you've had the test, and if it comes negative, then you'll be called for the test after 5 years. But during the intervening period, if you experience any unusual bleeding or heavy bleeding or after menopause, unusual vaginal discharge or deep pain, then you must certainly approach your GP and get it checked out. So do not wait, because since you have done the cervical screening, do not wait for 5 years if you experience these unusual symptoms. Now, so the actual process, usually we get the cervical screening test done at our GP's clinic. Some women's health centers also do it, and some community health centers also do this test. Now, so the process is the doctor or the nurse who conducts the screening test would ask you to lie down and preferably to remove the lower part of the garment, and you can actually ask for a female GP to do it or a female nurse to do it for you. So you, as shown in this slide, the position where you slightly bend your legs. Sorry, let's go back to the same. And you're asked to keep your legs relaxed and also keep your body and mind relaxed. So that makes the process easier for you. And you will not feel much discomfort. Now, what is done during this process? So, just coming to the the instrument that is used, this plastic instrument is the speculum. It is introduced into the vagina to keep it open, and then a brush is introduced into the cervix to skim off some of the cells from the cervix. And then this brush is removed from the cervix and put into it used to collect a few cells from the cervix, and then they put into a liquid which is sent to the laboratory for testing. You could feel some discomfort during the test, but it would not, generally it is not painful. And of course, if you feel any pain, you can definitely let the doctor or the nurse know. So it does certainly help if the woman tries to relax when the speculum is inserted into the vagina. The actual test takes only a few minutes. So this is the collection process. Now there is one more process which I will mention, that is the self-collection, which needs to be done in the GP's clinic. But this is not only women aged 30 years or over can do this. And it's usually for women who have never had a pap test or a cervical screening test, or have been overdue for screening by 2 years or longer. It is not as good as a cervical screening test, but you need to talk to your GP before you decide to go for this process. Now, what happens once the test is done? What happens? So the doctor will receive the results in 2 weeks' time after the test. They would call the woman when the results come back. And if she has a negative result, she'll be invited to have the test only after 5 years. A negative result means that the test found no HPV in the cells of the woman's cervix. Sometimes a test will come back with a HPV positive result. This means that the HPV was found in the cells of the cervix. However, a positive result does not mean that a woman has cancer. In this case, the woman may be asked to have the cervical screening test in 12 months' time to check that the HPV infection has cleared. Or she will be referred to a specialist, usually a gynecologist, for a colposcopy, which involves looking at the cervix more closely to check for cell changes. Go to the next slide. So, yes, we have Dr. Rekha here to answer all your questions. But at any other time, if you need more information, you can actually look at this website, cervicalscreening.gov.au/cervical, or you can call the National Cancer Screening Register on this number, and when you're actually due for your cervical screening test. And you can also ask for interpreter service by calling 13 14 50. So the National Cervical Screening Program is a free program. So all our cervical screening tests are done for free. And if you visit the website, you can get much more information. I'll just go to the next slide. Okay, the National Cancer Screening Programs also have information about the National Bowel Cancer Screening Program, as well as the breast screening program. So you can get more information on these two types as well. So this manual, this information manual, has been produced by the Cancer Institute of New South Wales. And the Pink Sari team has undergone training with the Cancer Institute to deliver information sessions on cervical screening as well as bowel cancer screening and breast cancer screening. So any questions can be directed to Dr. Rekha Rao. Thank you very much for listening to this presentation. Hopefully it was clear to you. And so please pass the important message to your friends and peers about the importance of regular cervical cancer screening. Thank you very much.
That was a very good insight with proper, presentation, and it's just a very nice snapshot so that it's easier for everyone to understand and to know the importance of why it is necessary and, to shed some light on that. It was very nice to capture that in a very short presentation, and you had covered everything in there. And Kashmira, thank you so much for, snapshotting the presentation in a very well mannered thing. It was readable and it was very nice to understand as well. Thank you so much for doing that. And we have Dr. Rekha Rao, who is as busy as a bee. She's just finished her clinics and she is on her way to another presentation. Welcome, Dr. Rekha Rao. Thank you so much, Rekha, to come into this platform for us once again. And I know you are so busy, and especially these days where Omicron has taken over everyone's life, isn't it?
Yes, very true.
Yeah, it has become such a busy work for everything, especially the health professional. And me also working for health professionals, and you being a health professional, I can understand how busy your schedule is. And really, thank you very much for joining in. And
with pleasure.
Yeah, and I've got a very few questions for you, Rekha. I won't take much of your time. And Dr. Rukmini showed the presentation and just explained how important it is to undergo the screening for cervix. So in your day to day, obviously you would be seeing so many patients with on an ongoing problem, etc. Why do you think it is important to take care of the cervix?
Okay, we all know that any woman is at risk of getting cervical cancer, and it is a preventable disease. And one of the very easily preventable and treatable diseases is early diagnosis or prevention of cervical cancer. In the past, we used to focus more on early diagnosis, and that's why we had pap smears. But now with the intervention of the National Cervical Screening and Cervical Vaccination Program, we have the Gardasil vaccines, which we give to very young adolescents, both male and female. And that is going to radically reduce and empirically decrease the risk and diagnosis of cervical cancer in women. The vaccine does not mean that you will not get the cancer, but at least there are some very dangerous strains of the HPV virus, and this vaccine can give immunity against those viruses. So a disease which can be easily diagnosed and prevented is cervical cancer. And that's why it's very important for us to actually encourage and educate women about the importance of screening, doing what is required, and looking after themselves.
All right.
Just engage the people in what is right for them is where a role of a general practitioner is. To educate them and tell them, have you had a cervical cancer screen? Because we don't call it pap smear anymore now.
Correct. Yeah. So is that actually practiced in India as well, Rekha? Because the group of mine is majority from India.
Yeah.
So I think in Australia it is quite different and everyone is well aware of it. If not, like, we are kind of like, spreading the awareness. But what about in India? Like, what is happening? Do you know?
Yeah. In India, pap smears are still being done.
Mm-hmm.
They are doing cervical cancer screenings, but it is not reaching everyone. The reason is awareness. People only go to doctors when they are not well.
Correct.
And they don't go as a screening program or a screening test for their well-being.
Yeah.
And I think with your Sari gallery, this is what you're going to promote.
Yeah.
To make women aware.
Yeah.
And to understand the importance of pap smears, how a treatable disease or a preventable disease can be
cured,
managed all over the world.
Yeah. Okay.
Women, we should feel that we are important and look after ourselves.
Yeah.
Yes, they are doing it. I have a lot of gynecologists in India who do it.
Yeah.
And the only problem is it is not an interactive, engaging relationship between a doctor and patient. In India. Yeah. Whereas here, when the patient comes, we say at this age, have you done this? Have you done that?
Correct.
So through such channels,
yeah,
we can educate all women to take their own responsibility. I mean, you undertake your own care and go and ask the doctor, do I need a pap smear? Do I need cervical screening? I heard about it. And ask him to do it.
Right. So see, if they are aware of it, then yes, probably they would ask their doctor. But if they are not aware of it, and sometimes there's a great barrier between what to ask for and to come forward.
Yes.
There's a difference. So they should be made aware of it. Is there any way that that could be promoted?
I think it's only media. And with technology and all such openings like your Sari gallery, any other, TikTok, Pink Sari, any of these things.
Yeah.
And there is awareness. I mean, people are smart. There is a high level of education among the Indian women now. And they're all technically savvy. But for them to understand that it is their own body that they have to look after first.
Yeah.
And that comes within oneself. And it starts from the mother to teach the daughter.
Yeah.
And that is where I think we as mothers should start educating our children and say, look after yourself, do the pap smears, do the mammograms, do the bowel screening. And the only way we can do it is education.
Yeah.
Whatever, it could be media, it could be technology, it could be word by mouth, doesn't matter.
Yeah.
The more people we can reach out, the better it is. There are a lot of deaths in India because of not doing pap smears and cervical screenings.
Yeah.
The only other thing I really wanted to talk about with the HPV virus and cervical screening, it's not only diagnosis cervical cancer, but this papilloma virus can cause vulval cancer, vaginal cancer, and anal cancer also.
Oh, yeah.
So by doing the screening, which we are doing now, the HPV, and if they have this high-risk virus strains, we can monitor them and actually prevent them from getting all these other cancers too.
True. Okay. So earlier the better.
Earlier the better.
Yeah. Okay. And again, you mentioned about pap cervical screening test. So I know here they have replaced the pap smear test with the cervical screening, and now it is once every 5 years, as Dr. Rukmini mentioned, and pap smear is completely out of the way. But in India, they're still doing that. So, do you think that, at least, if not the cervical screening, which is not introduced there, can the ladies go and get pap smear done at least?
Definitely. Pap smears can be done. And in quite a few places, they are doing the cervical screening too.
Okay. All right.
So, and I'm not sure about the availability of the vaccine in India.
Right.
But it is there in all other parts of the world. I think in some urban parts of India, the vaccine is still there.
Still available. Is it easily affordable? Sorry, not, I won't say easily. Like, is it affordable for the general kind of like, targeted group, or like whether they could afford?
Actually, yes, it is. It is. Though it is very expensive in Australia, I think there is some national scheme where the vaccines are not that expensive in India.
Okay. So it is available.
Again, it is not done as a routine, and it's more by choice and more by awareness. And that is the sad thing.
Yeah. So ladies, just make sure, like, when you visit your GP, which obviously I don't know how often you ladies go back there in India, but here, like, it's a general routine, especially when it comes to the pap smear time, like now it's being replaced by cervical screening or breast screening. We make sure we go to the GP and get tested. So that's that's an indication for us to get that done. So ladies, just to grab the opportunity, just go and see your GP and just take advice of that. And I've got one more question for you. Is it safe to screen during the current COVID-19 situation?
Definitely. The delay in diagnosis and management because of COVID has become very, very bad, because people think they are so scared of getting COVID that they're not coming.
Correct.
We can delay for, like, if your pap smear is due now, you can delay it for 2-3 months, but delaying it much more than that is not good. We also have a few people who are in that low grade abnormality or possible, they have the HPV virus, but not the 16 and 18. And these people need a pap smear every year. 2 negative smears should be needed. And these people should come and get a smear, because only 16 and 18 is found, but there could be other strains of the virus which can cause cancer. And if they are not coming on time to get the smear done, then they may miss out. And low grade can become a high grade lesion or a very aggressive lesion. So we can delay it for 2-3 months, but not more than that. So I really advise women to be safe, wear a mask. The doctors are also, the doctors are also at risk of getting COVID. And we are still risking it, so that we do look after the patients, and we do look after all of you women. So please come, wear the mask, and the doctors, and we make sure that you keep an appointment, come on time, go back. The risk is very minimal of getting a COVID. The risk of dying of cancer is much higher than the risk of dying of COVID.
Okay. And is the test necessary if one has received a HPV vaccine?
Yes, it is very much necessary, because HPV vaccine only covers a few strains. But there are a lot of other strains which can cause the cervical cancer. And also, we know when there are aggressive strains, we actually send them for colposcopy, which is a special camera where we look into the cervix to see what is happening. But there are other strains which can cause cancer, but we are not much aware of how they progress. And these people are monitored more closely by doing more pap smears. So in this gray area, these people will need regular testing and pap smears. So just because you've had a vaccine, it will reduce the risk of cancer. It will reduce the risk of aggressive cancer, but it can still cause other types of cancers and other strains. So we need to do pap smears routinely.
Okay. I have another question for you. Do women in same-sex relationship have to undertake a cervical screening test?
Yes, they should, because HPV is a sexually transmitted disease, whether it's same-sex or male, female, it really doesn't matter. Because it's a virus. It's like a what virus, and anybody can get it. So yes, everybody needs a pap smear.
Okay. And does a woman need to be screened if they have not been sexually active for a while?
Yes, anyone who's even been sexually active once need a pap smear screen from the age of 25 to 74. And based on their results, we decide how often they would need it.
Right. Okay. And is it safe for a pregnant woman to undergo the screening?
Very safe.
Okay.
Yeah. So it won't interfere with the baby at all. We are only taking a smear in the outer rim of cervix, and the baby is in the uterus, much far away. So it will not affect the baby at all.
Yeah. So like, do you call it what do you call that thing?
The speculum.
Yeah, so it doesn't reach the womb, is it? Like it doesn't go.
The speculum is only to open the vagina,
Yeah.
which we do even when the woman is pregnant, to check the baby, to check the cervix is dilating or everything.
Yeah.
So, and we take a pap smear from the cervix, which Rukmini has already shown the picture of, and the womb is much higher up. So there is no way it will affect the pregnancy.
Okay. And I have got another last question. What if a woman is sexually active from a very young age, even before they turn 25?
Okay. With the new guidelines, that's the reason why we are giving the HPV vaccination. And we give the HPV vaccination in adolescents. And if they've all had the vaccination, they don't need a pap smear till they are 25. All said and done, if they have any other symptoms of irregular bleeding, intermenstrual spotting, pain, any of these things, then they should have a pap smear before the age of 25.
Right.
In an asymptomatic woman who's been vaccinated, you need a pap smear after the age of 25.
Right. Oh, that's very good to know. I think you have covered all my questions. What I will do is I'll ask the group if they have any more questions, and perhaps if it's anything related to your subject. So
thank you.
I'll be referring that to you to answer. I'm sure they would be benefiting from Q&A what we had, and I really appreciate your time. I know that just come back from work,
That's okay.
Driving, I thought you would be in the driver's seat when I saw you. I mean, passengers, but still you were able to join us for this brief but valuable conversation. And thank you so much. And I also thank the Pink Sari the Pink Sari group, not Pink Sari Incorporated, who gave me the opportunity to team with you ladies to promote the cervical screening awareness during this beautiful January month, so that all the ladies in the group can get screened. So we have to say, get screened, ladies. And the color for cervical cancer month is teal. And that's the reason I'm wearing a teal color. So we'll promote that teal with a heel concept. And again, thank you very much for the gorgeous ladies here. Can we see all the four of you together?
Yes.
And I would like to say something about Kashmira, who is just behind the screen. And she's in her beautiful Tussar silk sari. And all the three of them, of course, are wearing the same beautiful pink sari. But the specialty of Kashmira sari is so beautiful. Come on, Kashmira, show me your sari. I have to promote the draping style.
Oh, you don't. All right, so
you can do the demonstration, Kashmira, please.
I will. I absolutely will do it.
Thank you so much. Thank you so much.
Hema, is there something else I wanted to add?
Yes.
Is that this project, the Cervical Screening for Survival project, which is funded by Cancer Institute, New South Wales, mainly to raise awareness about cervical cancer and screening in the Indian and Sri Lankan communities in Sydney, mainly in Western and Southwest Sydney. However, we would like this message to go far and wide, not just to the Indian and Sri Lankan communities, to everyone. So thank you for that. But I also want to acknowledge that our partners are the Australian Indian Medical Graduates Association and the Australian Medical Aid Foundation. So Dr. Rekha represents the Australian Medical Aid Association. So we're very, very, we intentionally brought together these two medical associations, because one represents the Indian and one represents the Sri Lankan, because I think they have a very major role to play. As Dr. Rekha said, they engage very well with the patient. So there is an opportunity for the doctor to ask the patient whether they've been screened or not. So they play a very major role. So we are very grateful to both of them as well for coming, for being our partners and helping us take our message. And My request is that everyone who's listening, everyone who's watching, your responsibility doesn't stop here. Please take that message to all the women in your lives.
Yes, that's very true. Very true. Yeah. It was a nice summation up there. Yeah.
Thank you. Thank you.
Kashmira, you are going to show me a demonstration, like, your sari draping style. There's so much to learn from you. You have done it so neatly in a different way. I would like to see a demonstration.
All right. So, as we all know, these are the times of COVID, right? With COVID comes, life has changed so much during COVID, and things have now been turned upside on its head. So there are times when I have to attend meetings for work because I'm working from home. When you're going into the office, there is this thing about presenting yourself in a certain way. When you're at home, yes, most days I dress up like I would be going to work just to get into that frame of mind of working. But then there are times when, like today, where my focus was so much getting all the speakers and everything together the way we did, that dressing up and being presentable was, yes, a very big part of it, but my focus was more on getting things done. So when we started this session, now I'm going to do a little bit of striptease. But
it's good to have some fun, right?
Yes, we do have to have some fun. So
exactly.
This was what I was like. I was working, getting all the speakers ready and going through the paces, this, that, and everything. Yes. And then came time to become Pink Sari Inc. representative. So this is what I did. So this is my top.
Yeah.
This is my sari.
Yeah.
Right. So all I did was, I'm wearing top and trousers, by the way.
Yeah.
And this is my sari.
Yeah.
So all I did was took the sari.
You're okay?
Yeah.
Yeah.
I need a glass of water.
Yeah. True. Talking so much.
No, I tell you what, anyone coughs in these times and you kind of step away from them. I could almost feel everyone stepping away. So this is what I did. I took my sari.
Yeah.
Put it like this. Got the pin.
Good, at least you pinned it.
Oh yeah, because otherwise, see, I have to constantly move the mask and everything else. I can't be sitting here. And then, just so that people would not see how mismatched the top and the sari were, I then become
Jaya Baudri.
Adarsh Bhartiya Nari and cover myself like this.
I would say Jaya Baudri.
Look, there was a time when, very unbeknownst to everyone, I didn't realize that the sari had stuck on my ponytail. Yeah. So the whole time I sat like this, and somebody did say, "Why are you being such an Adarsh Bhartiya Nari?" So I was like, I don't know. So here is the tip for anyone who has a last minute meeting that they have to attend. For this meeting, because the uniform, uniform, we love to wear these saris, and we wear the same saris, all of us, the group, only because in face-to-face events, when anyone has a question, one about the group, what we do and anything else, and even something simple as about the venue. So they know exactly who to go to, even if they want to ask where the toilets are, right? Yeah. So they know who to go to. And that's why we dress the same. So people know that we're part of a unit, and that's why. So this is what I do.
Oh, how many different saris you all have? Obviously, you can't wear the same sari every single time. You should be having a few.
Look, every year we get a new set of saris. We try for every event. It has to be the same sari that we wear, because people need to know that this is a group. And correct. I tell you what, the kind of feedback we get about the way we are dressed, because we all love saris. We take pride in our name is Pink Sari Inc, right?
Yeah.
We take pride in wearing our saris. We take pride in dressing up to suit the saris. So if you look at Shantaji, I love Shantaji's big botu. Her big bindi is such a trademark Shantaji thing.
Yeah.
It's unbelievable. And Rukmini looks that very graceful, qualified professional with that edgy hairstyle.
Correct.
And the sari draped like that. Honestly, and you've not met Viji or Anup or Aparna. We all have our ways of presenting ourselves, and it is so cohesive and beautiful. It's not funny.
That's very nice. Very nice. See, we had a little bit of fun with saris as well, saying the Sari Gallery Group and the Pink Sari Incorporated. So we did have a little bit of fun there. Thank you. Anything else to say before we wind up?
Shantaji?
Well, we've got Pink Sari's got still a long way to go. The cervical screening is not the only thing we do. As you mentioned earlier, we are also involved with Project Beyond Pink, a totally new project. It's about that we're working on. And so we've just done a call out for volunteers. So hopefully we'll be assessing them. And if anyone's interested in volunteering with Pink Sari, please do feel free to contact us.
Yeah.
And we are only a small team from the diverse language groups.
Yeah.
But we would like to grow. And I think we're so indebted to the community because we couldn't do what we do without the support of the entire community. Rekha covered today and about India. I think it's so relevant because I'm sure a lot of the women may not be aware.
Correct.
So this would have raised awareness for them. And I'm sure there'll be other women's groups in India who would like to do what we do here and raise awareness, because the conventional methods of promoting doesn't seem to work that well.
Yeah.
And it's word of mouth and, people within the community also talking about it and spreading the word that really, really helps. And I think, this is a great way to take our message across.
It was very nice having all the four of you. And I thank you very, very much for coming on my Wholesome Wednesday platform.
Thank you, Hema.
Thank you. Thank you, Rekha. Thank you, Rukmini.